We have the community health volunteers. We have health workers working at dispensaries and health centers, which are very near the community, who actually should be sensitized so that they can be able to pick, or if a family member or a member of community picks, they can be able to liaise with these people and they will facilitate how these people can be taken to hospital. And this has not been done, and this has been found. And because I participated in this mitigation in West Africa, this was the single most important intervention that actually helped to mitigate that. Because once it gets into the community, and if they are not educated, if they have been not been provided with protocols on how to process that, it can spread like bushfire. So we found that even the infection prevention measures are actually not being enforced. You find near border points where it's a very high risk area, people do not have masks. There is no hand washing points. There is no social distancing. And so then what that means is that the people we represent, the health workers, the clinic officers, are very vulnerable. Because the first person to fall in is going to present it to a clinic officer in an outpatient facility. The same thing we saw with COVID. You remember the first people to be isolated were clinic officers here in Nairobi, because that is where anybody who falls sick will first seek the health services. And when we went to those dispensaries and health centers, and even at the outpatient of some level 4s and level 5s, where they will be able to also come, we found that health workers have not even been provided with something as basic as a mask and gloves and a shield or goggles and even an apron, because that is the basic protective gear you need for somebody who will be either triaging or in the consultation room, who will then be able to pick up and inform the others that probably this is a case of Ebola. You need to isolate this person, and of course now we can wait for the confirmatory measures. So what we have been asking the ministry and the county governments is it's time that we get serious.
And they are actually along the highway that connect the two countries. And to such, people might be moving even without any stopover. The only first stopover will be their place, and that person might be picked while they are there and be taken to the hospital. So we realize that this is contributed by the virtue that they have not been trained. And all the counties, and as I have mentioned, going to Migori, even at the border side, nothing is being done. People are freely moving around. And also we were in Vihiga, nothing is in place. No surveillance, no emergency team that has been put in place, no sensitization to healthcare workers. Population around those counties don't know anything. So that's why we have recommended specific measures that they need to do to ensure that we train our people. Let's prepare, because there is nothing wrong from preparing, but there is everything wrong if we don't prepare, and yet we know that our neighbor's house is burning. So we must be able to prepare in time and ensure that we are able to tackle any case if it comes. And the other issue that we need to put into context is that there is a reassurance of the ministry that we have been able to prepare. But when you look at it, the pronunciation are being made from the boardroom and the hotels, and this does not amount to indeed to preparedness on the ground. So if you check out those counties that we have checked, more than a half of the 20 counties that was enlisted as high risk, then you realize that every county actually rating was less than 10% in terms of if there was people with the knowledge about Ebola. So that one is a good information that they need to take and utilize it to sensitize the people, because we must be able to do what it takes. And health is not about waiting people to be sick. Health is about preventing cases, preventing conditions that can kill our people.